Hi everyone, welcome to my channel Capsa. Today we will understand about urinary tract infection or UTI. So UTI is the commonest bacterial infection of the bladder and associated structures. It means the structures which are associated with the urinary tract. It can be bladder, it can be urethra, it can be ureter, etc. Okay. So when the bacteria travels from the skin or the rectum and enters to the urethra or your urinary tract, or if there is any remaining urine in your bladder, it can cause the bacterial infection in your urinary tract. Okay. Now which kind of bacteria can cause the urinary tract infection? These are mainly Escherichia coli, Klebsiella species, Candida species, Mycoplasma, Chlamydia. This kind of species can cause urinary tract infection. An interesting fact is uropathogenic strain of E. coli can cause 75 to 90% of acute UTI which caused by this kind of strain, and remaining 20%, if it considered 80% caused by acute UTI caused by Escherichia coli, then remaining 20% acute UTI actually caused by Staphylococcus saprophyticus. This bacteria can cause UTI in young sexually active females with the age of 13 to 40 years age, those who are sexually active. Okay. So elderly patient or the person which has age more than 60 years, that kind of adults are more affected. Besides that, young children are more likely to affect by UTI. Among them, obviously 50 to 80% women are infected by UTIs. Now, why the women are get infected by UTIs? Because the length of urethra is shorter in case of female than males. It's about 4 inches. Okay. So, the length of urethra is about 4 inches. And the prevalence of UTI increases with the age, and in women aged over 65 is approximately double the rate. It means the women who get the more age, the more prone to get infected by the infection. Okay, UTI infection. Now, what are the signs and symptoms? So, first main symptoms is pain or burning sensation during urinating. Frequent urination, bloody urine, it means blood is present in the urine. Pressure or feel cramping or pain in the lower abdomen part. Fever, nausea, vomiting. Fever is mainly associated with the children. And nausea, vomiting is associated with the adults. Frequent urination is mainly associated with the old age patient. This is common sign and symptoms for the old age patient. Okay. Now, what are the risk factor, or which type of patients or which type of persons, male or female, can get infected by this infection? So, if the patient has previous history of UTI infection or family related risk, means if there is any one of them family members are get infected by UTIs. Third one is patient with age 65 years and having urinary incontinence, urinary retention, this kind of problem. Patients suffering from diabetes, obviously the patient which are suffering from diabetes, they have the symptoms nephropathy, and if there is infection of if the patient have nephropathy, obviously will be a chance of infection. Okay. So men with enlarged prostate, young children who is having their training of toilet training, if they are not taught proper hygiene, they are get infected. Patients recently experienced urinary catheterization. Okay, in the 48 hours of catheterization, the patient may suffer from UTI. Now, what are the common forms of UTI? First one is cystitis. What is cystitis? If the bladder infection occurs, then it is known as cystitis. Urethritis means infection within the ureters. Pyelonephritis means when the both kidneys are get infected with UTIs, that is known as pyelonephritis. Uncomplicated UTIs simply just when an healthy individuals without any physical and functional defection gets infected with UTIs known as uncomplicated UTIs. And complicated UTIs is when the healthy person is with blockage or obstruction in the urinary tract having UTI. This kind of patient is known as have the complicated UTI. Catheter associated UTI means if the person has recently been catheterized in the past 48 hours, that is catheter associated UTIs. Now, what are the diagnosis procedure? So, first diagnosis will be based on your symptoms. What kind of symptoms the patient is showing. The second is based on some physical examinations. Okay, and the third one is urine test. Your urine culture is sent to the lab and they will test your urine sample under the microscope and they will see if there any kind of presence of bacteria or fungi or any kind of germs are present there. So these main three things are main diagnosis procedure. Now coming to the next, what are the treatment? So the main treatment is obviously medicine, and if there is medicine, so antibiotic comes first line of treatment for UTIs, obviously based on the type, which type of UTI and what are the complications associated with the UTIs. So main examples are UTIs nitrofurantoin and sulfa methoxazole trimethoprim combination therapy. Okay, these two medicines given in combination and this is individual. With that, obviously changes in the lifestyle, follow the home remedies. Which kind of lifestyle? Simply just drink plenty of water, avoid alcohol, use some heating pad if you feel cramps in your abdomen. This kind of home remedies should be followed. Okay, so this is the end of my lecture. If you like the video, please do like, comment, share and subscribe. Thank you.